I'm going to go ahead and get started, and I'm going to briefly introduce our guest speaker today. And I'm very happy that Elena Creech, is it Creech? You've got long E's in there. Okay, I thought so. Is with us today. Elena is from Harlan County, Kentucky. If some of you guys had not heard that yet, we were chit-chatting earlier on when we logged on. And Elena was born and raised there in Harlan County, Kentucky, and she is a dedicated public health nurse. And I get this right, 25 years you've been a public health nurse, and so that's pretty awesome. So you get a crown today, is all I can say. You're wearing that crown. Yeah.
Well, I will wear it proudly then, because
Yes.
public health is something new every day.
I can only imagine.
Through the years that I have been here, I have learned not to say that won't happen again, or that's the worst that can happen, because there's always something else to take it.
Yes. And so she wears lots of hats, but I'm going to give her lots of crowns today. So she's got lots of crowns that she wears. And you're currently the nurse supervisor there at the Harlan County Health Department, right?
I am.
Anything else that you want to tell us about yourself?
I don't think so, Sheila, but thank you for that introduction.
You're welcome. And you guys are pioneers, and that's the name of your all's presentation. She's going to talk about how they about the partners that they have, and how they partnered with the Lake Cumberland Health District, I believe, and how you guys have facilitated a remote diabetes self-management education program there in Harlan County, in the heart of coal country.
That's right.
Okay.
Well, let me start off by saying thank you, Sheila, for inviting me to be on here today. I'm not a good public speaker, but I know that I'm talking with other healthcare and people that are so interested in our diabetes program. So just bear with me, and we'll get through this next 30 minutes together.
Okay. All right.
I would like to give a little bit of history from the beginning of why this all took place. We are a small health department, and of course we don't have staffing to do everything we want to do. So we try to do the best we can with what little bit we have. And back in 2019, I had a phone call and a follow-up email from Jamie Lee. And I know you know that name, Sheila.
Absolutely.
She was the diabetes educator for Lake Cumberland at that time. She's since retired, but let me tell you, this child right here, she was the catalyst for all of this. So with that being said, she's run an idea by me. I had so many people that were needing diabetes education, just self-management, just what is diabetes? Just that simple. And we didn't have anybody that was trained in the program for Kentucky to teach those classes. So Lake Cumberland does have people that are trained. And so we decided we would form a partnership between their nurse that is trying to do that diabetes self-management education classes remotely in Harlan. At that time, COVID hadn't occurred, so remote was a new thing at that time. And so this is kind of funny, because this is how we started out. She helped me get everything together, and we contacted our good friend Sheila Plogger, who was had a hand in it from the beginning, because she is the one that helped us start our coalition back then and project forward what we needed. And of course, Marshall University was so good to help us with the things that kind of came up that we would need funding for. So thank you, Sheila, and thank you, Marshall. And they are great to work with if anybody hasn't had the chance to work with them. But anyhow, we had a room that we could meet in because we were still meeting in person at that time. And it was our local extension office. They have, I'm sorry, I thought I heard somebody. They had a meeting room that we could use. So the extension office decided to partner with us because they have valuable information to support the diabetes community. So then another person I thought about was our local community health worker. She works at something called Kentucky Home Place, and her name was Darla Shepherd, and she was very helpful. So those three partners kind of went together and provided what we could, each one of us. So I was the one that was responsible for having the education part of it. The extension office helped with the meeting place, plus they fixed meals every class. And then the community health worker was there to help me with handouts and information, questions people had, just kind of troubleshooting everything. So we had our first meeting. It went really good. We used a big screen like you would see at an outside movie theater. We had that set up inside. We had a little projector that would shoot the image of Jamie Lee on the screen, and the people in the room would be watching like a big screen TV, but it was live like we are right now. So they could ask questions. They could, see her talking, see things that she was had on display, and everything went great. It ended up being just like you would do in person. It was a 4-week course. It was the full-blown DSMES class, and people really, really enjoyed it. Now, fast forward to the end of 19, we had managed to get in 2 remote classes like that. It was going great. And then you know what happened? COVID.
COVID.
COVID happened. So sadly, that took up the last 3 years of a lot of health department work. We're just now getting back on track to having the remote classes. We did have a class this past April that was a 4-week class, and it was taught by Janet Coward. She is also the diabetes educator in Lake Cumberland. Very good to work with. Those girls were so patient with me. And it was a learning experience for all of us, but it showed that you can provide education for your community, even if you don't have somebody trained to do that education. I do have some slides that Sheila is going to share that in Kentucky, it will show you a map of all the counties in Kentucky that have somebody that is trained for their education. Now, some of these health departments are in a district where they're together, and some of them are independent, like we are, that just has that one health department staff that's working with them. So you can see on the map, the areas in white are the ones that do not have an educator in their area. So anybody that is interested in having diabetes self-management education classes, I would urge you to contact one of the areas closest to you that could set up to do the Zoom classes like we've done in the past.
Hey, Elena, I have a question for you. How did you recruit your participants? Did your community health worker help you with that, or how did you initially do your recruitment? Because I know it was a lot of legwork that you guys done.
It was a lot of work from the beginning to the end, but at that time, there was nobody in Harlan that was doing diabetes education. So patients that would come into the clinic newly diagnosed or even had, if they had diabetes for a long time, they had so many questions, and we just knew that we've got to help them with education, because that's the key to diabetes. If they understand diabetes, they're going to do so much more better health wise and diet wise. So we reached out between me and the community health worker and the extension agency. We went to every provider in the county as far as medical providers to let them know what we were planning. We took a referral sheet so that if they knew diabetics and knew people that needed education, no matter how long they had had diabetes, they gave them that information on the class time and the schedule. We advertised it on Facebook. We had it on the radio and just word of mouth. So our first class, it just went fabulous. There was 30 people that attended that first class, and most of them by the end of the 4 weeks, they had attended class. One or two weren't able to complete it just for reasons out of their control, but everybody was so interested and involved, and it just made the whole process great and worth all the time and effort that we put into it. But like I said, Jamie was an old pro at this, and she knew exactly what I needed to do as far as outreach and getting my diabetes education material together, because even though you were seeing her on the screen giving the education, I had all of the displays, the paperwork, anything that they were interested in looking at, educational material, books, the class book, everything was there in Harlan with us. So it was just like she was the only one that wasn't in the room. Technically, she was there, but she was up on the screen. So it just worked.
It's really innovative too, because I know it's very hard sometimes to do things like that online. And a lot of times people don't want things. At least that's been, that it's harder for them to be online. Maybe they have, technical difficulties, or, they're a little intimidated with doing things like that. But wow, I mean, that partnership that you guys made, and just the having Jamie on board and really just kind of
Yeah.
tying into somebody who has done that, knows what to do with it. Yeah, like Elena said, I encourage you guys to, open that up, and really, if you don't have a health educator or someone to do that, to lead it in your county, to partner with someone else, partnering county, or as you can see, I don't know, Lena, this is Harlan County right here. So you guys
Correct.
can see my cursor.
Uh-huh.
And then Jamie and them are over on this side.
Correct.
They're
Correct.
quite a while.
Uh-huh.
There's several hours of drive time. So
Yes, and there's a time change in there.
oh yeah, I forgot about that.
So,
Yeah.
so we were dealing with that, but all kinds of things will come up during this process. Where am I going to get these books that are approved for diabetes education? And between all of us, everybody brought something to the table that, hey, I've got that. Mark that off your list. I can do that for you. So, I mean, once we had it set up that the first class was ready to go, everything after that just fell in place. It was so very organized, and it just worked. I don't know. It just worked.
That's awesome. Does anybody have any questions for Elena? Feel free to ask. Or you can put it in the chat box.
Sure. Or you can reach out to me. Sheila has my email, of course. So she's welcome to share that, and I can put it in the chat too. But if you would be interested in doing something like this in your community, please reach out to me, and I will help you all I can. I can at least point you to the resources that I had. So
I do have a question, Elena.
okay.
Tammy from, I believe, Clay County, Kentucky. She says, did you have problems with lack of participants? Because she has struggled continuously with recruitment.
In 2019, when we kicked this off, we had no problem with participation because everybody, well, I mean, you know, just working in public health for as long as I have, I knew there was a need. It was just a matter of deciding, how are we going to address this? There's a need, we've got to address it. One of the local physicians happens to be diabetic. So it didn't hurt to have him recruit for us. And in fact, I didn't even know that he was diabetic until I went out. We were doing our outreach and saying, hey, you know, if you have new diabetics or even people that aren't new but have a lot of questions, we're going to have this class. Can you help us? And he was fabulous. I mean, he was on board from day one, and that's how we found out that he was diabetic, because he shared that with us when we went out to ask him to give out the referrals and the flyers and things like that. So the first two classes in 2019, no problem filling them up. I had 30 people at both series. So that was great. But, you know, then the pandemic happened. So it was like everything kind of cooled down. People, I don't think they lost interest, but there was more pressing issues at that time, and our staff was pulled away from doing a lot of the outreach that we did normally. So we didn't ignore diabetes, but we were very limited on resources and things that we could do. So basically everything was social media. Lake Cumberland did continue to have Zoom classes during that time, and I would share that schedule because it was for anybody. If you could link on to the Zoom, you could participate in their class no matter where you were from. You did need to register, so they, you know, would be expecting you, but there are pros at this, doing it by Zoom. So they would be a real help if you're going to do something like that. Now, was it Tammy? I will say that the classes, we did resume classes this year. I had a class in April, and I had a lot of people interested, but this time the problem seemed to be that the classes were going to be during working hours, and the majority of the people that were interested worked, and there was conflict in getting off work in the middle of the day to come to the class and going back to work. So that was one of the issues that we're addressing, is maybe having an evening class or a very early class. I don't know. That's something that we're reaching out in the community to see what would benefit you the most. Are you somebody that would rather do it after hours in the evening, like at 6 o'clock? I don't know, but you can be bendable like that. You can do your classes to situate any situation.
And I just pulled up the class schedule. I've got several slides for that too. And you know, you mentioned a while ago, Elena, that you had a referral sheet.
Mm-hmm.
And that physician that had diabetes, he made those referrals himself,
Mm-hmm.
and then folks just kind of just contacted you and
signed up for the class. It had the referrals, had all the information on it. Really, it was just a piece of paper that said, your doctor, recommend that you participate in these classes, and it had the schedule, the contact person, how to enroll in class, and that type of thing. So it was just a piece of paper, but coming from a doctor, it meant a lot to them, and they got the word out.
And they were probably more apt to use that as though it was like a prescription.
And that's what it looked like.
From their physician.
It looked like a prescription. It was on a tear-off pad, and all he had to do was put their name on it and give it to them and say, call this number. And then, that was it. So,
would you be able to just send that referral if you've got it in a Word document or a PDF or something, and maybe I could share that with folks? Once the recording for this and all that is done, if you've still got a copy of that.
I do. I
and
do.
maybe we can share that with folks. Susan and Karen, I know you both of you ladies are on here, and you guys do DSMES. Do you guys use a referral form of some sort or a prescription pad?
We get referrals from our providers, but a lot of times it's in Athena text, or it comes through our EMR. It's very informal. But that would be ideal if we did have something like that. I'm still trying to get them to give us access so we can actually put our notes when I do see them, because when I see outside providers, I fax notes about what we talked about to the provider so they can put that in the chart. If we had access, and it's just because people are busy here, they've just forgotten about it. But if we had access to the chart, Susan and I could put a note. We have access to the chart, but if we had provider status or whatever we need in Athena, then we could actually put our note in the chart and would be part of the medical record. Instead of being scanned in and then they have to find it, is it in clinical document, where is it in there? And depending on who scans it, it could be anywhere. So but we don't have an official document to answer the original question. No.
Okay. All right. Thank you.
I can get you an example of what we used.
I didn't really know everybody down there yet, but
that would be very helpful. I like that idea.
Okay. Yeah. And it's so easy. And it's easy for them. And that was part of our thinking, was let's make it easy and simple to sign up and give them all kinds of information. And I will have to tell you that our classes were 3 hours, but that included the education part. And then, like I said, the extension agency always fixed a diabetic meal for them, because the ending time was right at lunchtime. It was right at noon. And we knew that, some of them are going to have low blood sugar. So we want to share not only food with them, but we want them to know that there's recipes out there that taste good, are good for you, and you'll like it. So it was all about the education pulled together with recipes and food demonstrations on how you make this and how you can enjoy the food you love in the proportions and the fixing it the way that's healthy for you. And I can't tell you how much that brought to the table also, because I learned something new myself every class. And I felt good about that, because that's the way it should be. If it's a good class, you're going to learn something that's going to help you.
In Appalachia, we always like to say, if you'll have food, people will come.
Well,
So
we-
so Jamie was, so you had the Lake Cumberland Health District doing the remote classes, but those folks were coming and gathering there at your health department, or at the extension rather, and they would do the food and all of that while they were having the classes. So, yeah, so really it wasn't. Did you ever have any hybrid classes where folks could join you online if they couldn't be there in person?
We didn't at that time, but that's a great idea. And that's what I wanted to say about this class schedule that you got pulled up. Some of these classes in different areas are like that. They're the hybrid. They are in person or Zoom, and they're at different times in the day. So people can choose, if I work all day, hey, I can sit down, eat my supper, and watch this class. So I think that if the pandemic hadn't happened, we would be leaps and bounds by now. I have no doubt, because people still have an interest. But like Tammy, I think it was Tammy was asking a while ago about the participation. Since the pandemic, people, they don't want to get out and have in-person education, or not just education, but in-person anything. They're hesitant to do that. So I have had some that just, I know that they want to do it, but they can't. They're just not going to meet in a group situation yet. And my last classes were the first in-person classes that I'd had since the pandemic. So it did make a difference.
Mhm.
And, the interest, even though I tried to get the word out again, the interest wasn't there. But it's just, in a small community like ours, it's just something that has to get built up. If you just have 2 people come, those 2 are going to tell people how wonderful it was. And that's kind of the way that I look at it, is if I can give you the education that you're looking for, you're going to spread the word for me. And you're going to tell people that this is what you need to do if you want to learn about your diabetes, because it is just a wonderful series, a very educational. So it is a problem getting people to participate. But like I said, if you adjust the schedule and things for the people that are wanting the class, that'll help.
And I noticed here on your schedule too, you've got some scheduled between 1 and 2, and some in the evening time, 5:30 to 6:30 here.
Mm-hmm.
So,
And
yeah,
Sheila, this schedule is for statewide.
okay.
It is for anybody in the state. You could reach out to one of these virtual classes to register, or to see how to get your people registered, because we did do that during the pandemic for Lake Cumberland. They would send us our flyer and we would share it on social media and say, register for this class if you need diabetic education, because it's just like what we offered. But during the pandemic, you couldn't meet for it. Everything was closed. Our area that we met in was not available, and it just was not going to work during the pandemic any other way than virtual. So we did reach out a lot during that time for the Zoom classes, but they weren't meeting here in Harlan. It was completely virtual.
Okay. Nice. So the one that I'm sharing here, that was the state one that you guys used. Okay. I didn't even realize that you guys had all, and there's a ton of counties on here. I was just trying to look to see if, I know we've got Tammy on here, and she's from Clay County, Kentucky, and she's the one that had the question too. I think that's the last one. I didn't see one serving her county. Any other questions for Elena?
Sheila, if you have folks that contact you later, feel free to share my contact information. I would be glad to help any way I could to get your area signed up for these classes. And I will mention this, although I had them at the time, we had food models, you know, that for portion sizes. If you all have ever been part of the diabetic education classes, then you know they are very in-depth. And we have things you can hold in your hand to look at, and that helps so much. Even though the visuals help, it's having that hands-on. And we had everything that you would have in an in-person class. We had it here, even though it was a virtual class. So that helped a whole lot. And I think that people really like that, because if you're a person that needs to hold it to see really, you know, the measurements and stuff, it was wonderful. So we had food models, we had foot models, we had wound models, anything to do with diabetes and your health. We had it for them to look at as a display and for them to interact with. Now, let me also say this. We were talking about the extension agency doing the food demonstration, and they provided that food. So it helped on their end too, to have something to show for an event for diabetes. On the end of the Kentucky Home Place, we had incentives. Every class, we provided something for everybody. And at the end of the series, people that had attended all the classes got an Instapot.
Nice.
So it was just such a good experience, and people really benefited from it. So it was great.
Very good. Now, does anybody have any other questions? Everybody's enjoyed it. I did get a big thank you from folks. Karen says, I find participants learn from each other, and so do I. I appreciate your tips, and those really help. Thanks for the
Good.
ideas.
Well, good.
Yeah. And I'll send out to everyone once the recording has been downloaded and edited, and I send that out. I'll send these slides. I'll also send those documents that that you sent me, just so that they'll have a little handout. But Elena, if you can, after the email, when you get a chance, if you just send that, anything you've got, those referral forms or anything like that that you think would be helpful,
Sure.
I'll just share that out to everyone with the recording link. And for those, of course, who missed it, they can go back and watch it later on YouTube.
Okay, sounds great. And just keep me in mind. If I can help, I will. And thank you, Sheila.
I appreciate you, and thank you. And hopefully I can come see you guys in Harlan.